Hello! I'm sure you've heard plenty about the coronavirus. It's quite difficult to avoid at this point. More accurately though, the COVID-19 virus is part of a family of viruses called coronavirus. Regardless of semantics, I'm hoping to provide a useful video source with information on the virus itself, and the government precautions present throughout Canada. However, I'm no expert, and as such I'll be sure to link some reliable government sources which I used to create this video. I suppose it's best to begin with the disease itself. Though if you'd like to skip this section and go to the government precautions immediately, or are particularly interested in a certain section, a couple of timestamps will be attached to help navigate this video. So let's discuss symptoms. Though not everyone will experience symptoms, and those that do experience them will do so to different degrees, some common general symptoms include a cough and fever, as well as pneumonia in both lungs, and difficulty breathing. In severe cases, the virus also leads to death, with a notable increased risk for those over 65, those with compromised immune systems, and those with underlying medical conditions. The symptoms may seem innocuous, so it's important to note that there are tests available to confirm whether one truly has the virus. Symptoms can take up to 14 days to show as well, and one can pass the disease even if they don't yet show symptoms, or won't show symptoms. It's thus important to limit contact with others in general, especially if you've been in contact with a large number of people or were in a contaminated location. As the virus is typically of the throat, nose, and tongue, it spreads primarily through respiratory droplets generated in coughs and sneezes, through prolonged contact with others, and with objects contaminated via the virus. There is also an increased risk during travel. To limit the spread further, some particular advice which the government recommends is to avoid crowded locations and to not attend unnecessary meetings. One is also encouraged to avoid those who are at risk, i.e. the elderly, or those who are in poor health, and to keep a distance of 2 meters from others. One should also make sure to maintain hygiene with frequent hand washing, specifically following using the restroom and while preparing food. Hand sanitizer is encouraged when soap and water are not available, of course, and when coughing or sneezing, it's advised to do it into an elbow or tissue, and to dispose of that tissue immediately. Also, touching the face with unwashed hands is inadvisable. It's very important to note that one should sanitize frequently touched areas, preferably with one of the cleaners listed on this website, linked below. It's also possible to create a bleach solution. This bleach solution should be prepared according to the instructions on the label, or in a ratio of 1 teaspoon per cup, which these directions are based on the bleach that is 5% sodium hypochlorite, so that it gives a 0.1% hypochlorite solution. Next, let's discuss masks, the ever-popular precaution. It's important for these masks to be made of at least 2 layers of tightly woven fabric, be large enough to completely and comfortably cover the nose and mouth without a gaping hole, fit securely into the head with ties or ear loops, allow for easy breathing, be comfortable and not require frequent adjustment, be changed as soon as possible if damp or dirty, and maintain their shape after washing or drying. On the contrary, masks should not be placed on children under the age of 2 years, be placed on anyone unable to remove them without assistance, or anyone who has trouble breathing, be made of plastic or other non-breathable materials, be made exclusively of material that easily falls apart, such as tissues, be secured with tape or other inappropriate materials, be shared with others, or impair vision and interfere with tasks. Beyond this, it's absolutely acceptable and reasonable to wear masks, and they can be used in combination with other methods described. For most people, the disease should pass on its own, so it's advised that you remain at home and contact a medical professional if you believe you may have the virus. If you have the virus and the situation worsens, it's very advisable to seek immediate medical attention. Next, let's discuss children. With regards to symptoms, it's important to monitor for worsening symptoms such as fast breathing, difficulty breathing, confusion, an inability to recognize you, chills from fever, or fever that will not come down with fever-reducing medications for more than 12 hours. As if such symptoms do show up, seeking immediate medical attention should be a priority. However, before this, if the child shows mild symptoms, they do not need to be hospitalized. The monitoring and treating the child remain important. Washing one's hands and the hands of the sick child frequently for more than 20 seconds is also highly encouraged. Specifically, after contact with a child, such as changing diapers and after removing gloves, and 60% hand sanitizer and wet wipes can be used in place of water and soap when those are not available. In addition, it is recommended to make use of disposable paper towels when possible and to immediately dispose of them. However, using a towel which you wash after it gets wet and do not share is also acceptable. One should also avoid touching their face, nose, and mouth when they have unclean hands. Children should also remain at home, avoid playing with friends, and not attend classes in person. They should be encouraged to sneeze or cough into their elbows, and it's important not to share personal items such as toothbrushes, towels, bed linens, utensils, and electronic devices with the child. Separate food and drink and separate bathrooms are also incredibly useful. If separate bathrooms are an impossibility, one is encouraged to close the toilet lid after flushing. Breastfeeding is still encouraged for the health benefits it provides, though if feeding a child with formula or express milk, sterilizing equipment is highly encouraged. It's also encouraged to prevent contact with animals, as there are reports that the disease can be passed on to pets. And as such, it's important to keep an eye on children when animals are around. Disposal procedures for a glove and other contaminated items used during this time is to throw them into a lined trash can and bag the items, disposing of them with other trash later. Contaminated clothes should be washed via a special procedure. Specifically, it should be put into a plastic-lined container and washed with soap in water between 60 and 90 degrees Celsius. This does not include clothing worn by the child, and it's recommended to wear a face mask or covering when handling contaminated clothes. Those not caring for the child, but still within the household, should wear masks, gloves, and eye protection when within 2 meters of the sick child, and one should also monitor themselves for symptoms, and even when they are mild, isolate themselves immediately. With regards to what the government currently strongly recommends, regardless of symptoms, one should quarantine for 14 days if they are returning from travel outside of Canada, which is in fact a mandatory quarantine, have had close contact with someone who has or is suspected to have COVID-19, have been told by public health authorities that you may have been exposed and need to quarantine. And of course, quarantine means staying at home and monitoring yourself for symptoms, even just mild ones. Avoiding contact with other people to help prevent transmission of the virus prior to developing symptoms or at the earliest stage of illness. Doing your part to prevent the spread of the illness by practicing physical distancing in your home. One must isolate, on the other hand, if they have been diagnosed with COVID-19 or are waiting to hear the results of a lab test for COVID-19, have symptoms of COVID-19, even if mild, have been in contact with a suspected, probable, or confirmed case of COVID-19, have been told by public health authorities that you may have been exposed to COVID-19, and have returned from travel outside of Canada with symptoms of COVID-19, which is a mandatory isolation. Of course, isolation means limiting contact with others, which includes all of these different bulletins. One must also keep their hands clean, which enumerates all of these bullet points. One must, of course, avoid contamination of common items and surfaces. And, of course, they must also care for themselves. Citizens are also encouraged to stay at home unless they have to go to work, talk to their employer about working at home if that's possible, avoid all non-essential trips in their community, not gather in groups, limit contact with people at higher risk such as those older or those in poor health, go outside to exercise but stay close to home. This is only applicable to those who have not been diagnosed with COVID-19, do not have symptoms, have not traveled outside of Canada in the past 14 days, are not in self-quarantine, and are not isolating. If you, of course, leave your home, Always keep a distance of 2 arm lengths, approximately 2 meters, from others, and household contacts do not need to distance from each other unless they are sick or have traveled within the last 14 days. Thank you for paying attention throughout this video. I hope you found it educational at the very least, and goodbye.